Hello guys and welcome back. This is part 4 of a series of videos about the minimum dataset you need to obtain when you perform an echocardiogram. In this video, I'm going to talk about the apical 4 and 5 chamber views. Thank you for watching. Don't forget to like this video and to subscribe to my channel. So let's start. Let's start with the apical 4 chamber view. I'm going to show you one by one all the measurements you need to obtain of the apical 4 chamber view. First, obtain an apical 4 chamber view and perform a visual assessment of the cardiac chambers. Check the right ventricle, left atrium, and right atrium. Then visually assess the valve anatomy of the mitral and tricuspid valve. Also analyze the left ventricular wall motion and the right ventricular free wall motion. And don't forget to check the interatrial septum and the pericardium. Now obtain a zoom view of the left ventricle and visually assess the longitudinal and radial systolic function of the left ventricular walls. Analyze the wall motion of the inferior septum and anterolateral wall. Check for any regional wall motion abnormalities of the basal, middle, and apical segments. In the same view, start with the left ventricular volume assessment. Measure the left ventricular volume at end of diastole and end of systole. Left ventricular volumes should be obtained using 2D imaging from the apical 4 chamber and 2 chamber views. Trace the endocardial border and take care to ensure papillary muscles and trabeculations are excluded from the volumes and considered part of the chamber. And all measurements should be indexed to body surface area. Now let's continue to the left atrial volume assessment. Biplane LA volumes should be estimated using 2D imaging from the apical 4 chamber and 2 chamber views. Trace the inner aspect of the left atrial wall and exclude left atrial appendage and pulmonary veins. Also, all measurements should be indexed to body surface area. Now perform a zoom view of the mitral valve and assess the anatomy and excursion of both mitral valve leaflets. A3, A2, and P2 are the segments usually visualized here. Now, use color Doppler to perform a mitral valve color flow Doppler assessment. Check for mitral regurgitation. Look for abnormal, turbulent, or regurgitant flow. Now, perform a mitral valve forward flow assessment. Measure the mitral valve VTI to obtain the mitral valve peak and mean velocity and pressure gradients, measured by continuous wave Doppler across the mitral valve. If there is any regurgitation, continue with the mitral regurgitation assessment. For a qualitative assessment of the mitral regurgitation, align the continuous wave Doppler through the center of the regurgitant jet. It's important to visually assess the signal density. A faint signal is suggestive of mild regurgitation. The continuous wave signal density increases as the mitral regurgitation becomes more severe. Next, perform a mitral valve inflow assessment. Place the sample volume at level of the mitral valve leaflet tips in diastole. Use pulse wave Doppler at end expiration and measure the E wave peak velocity, A wave peak velocity, EA ratio, and deceleration time. Now use tissue Doppler imaging or TDI. Place sample volume at or within 1 cm of the insertion of the mitral valve leaflets and measure at end expiration the E' wave peak velocity, A' wave peak velocity, S' wave peak velocity, and E ratio. Here you can perform a MAPSI assessment. MAPSI is the mitral annular plane systolic excursion, and you can obtain this using M mode across the mitral valve annulus. Continue with the pulmonary veins assessment. Use color flow Doppler to locate the pulmonary veins and place sample volume 1 to 2 cm into the vein and measure at end expiration the pulmonary vein S peak velocity, pulmonary vein D peak velocity, pulmonary vein A reverse peak velocity and duration, and the pulmonary SD ratio. Obtain a zoom view of the interatrial septum and perform a visual assessment. Color flow Doppler is placed over the interatrial septum to assess for transseptal flow. A zoomed image is recommended, and color flow Doppler scale may be reduced to identify PFO flow. The next view is the apical 5-chamber view. Now I'm going to show you one by one all the minimum dataset you need to obtain of the apical 5-chamber view. Start by doing a visual assessment. In this view, what's new is that we can see the left ventricular outflow tract. So perform a visual assessment of the LVOT. Now in this view, we can see the aortic valve. So perform a visual assessment of the valve anatomy and excursion. And sometimes you will be able to also see the proximal ascending aorta. Now zoom on the aortic valve and left ventricular outflow tract and use color flow Doppler. Use color flow Doppler to assess for laminar or turbulent flow in systole and to assess for regurgitant flow during diastole. Now use continuous wave Doppler across the aortic valve to assess the aortic valve forward flow. Measure the aortic valve VTI to obtain the peak and mean velocity and pressure gradients. If there is any regurgitation, make sure to perform an aortic valve regurgitant flow assessment. Measure the aortic regurgitation pressure half time and visually assess the aortic regurgitation density and contour of signal. Also, assess the left ventricular outflow tract flow. Place the sample volume on the left ventricular side of the valve and measure the LVOT VTI to obtain stroke volume, cardiac output, LVOT velocity and gradient, and valve areas. And our last view is the right ventricular focused view. This is obtained from the apical 4-chamber view. So I'm going to show you one by one all the minimum dataset you need to obtain of the right ventricular focused view. First, obtain the RV focused view and perform a visual assessment of the cardiac chambers, the right ventricle and the right atrium. Also assess the tricuspid valve anatomy, the right ventricular free wall motion, and the pericardium. Now you can perform a right ventricular size assessment. Starting with dimensions, all right ventricular dimensions should be measured at end of diastole. Measure here the right ventricular basal diameter, the right ventricular mid diameter, and the right ventricular length. You can also measure the fractional area change by tracing the right ventricular endocardial border repeated at end of diastole and end of systole. By measuring the fractional area change, you can assess the right ventricular size and function. Now perform a TAPSE assessment. TAPSE is the tricuspid annular plane systolic excursion. You can obtain TAPSE by using end mode across the tricuspid valve annulus. Next, it's the right ventricular tissue Doppler imaging assessment. Using pulse wave tissue Doppler, the S-wave measurement is taken at the lateral tricuspid annulus in systole. Now continue with the right atrium assessment. Trace the right atrium. The right atrial area and volume is measured in the right ventricular focused view at the end of ventricular systole, on the frame just prior to the tricuspid valve opening. Now obtain a zoom view of the tricuspid valve and perform a tricuspid valve visual assessment. Assess the anatomy and excursion of the leaflets. Now continue with a tricuspid valve color flow Doppler assessment. Use color Doppler to look for abnormal, turbulent, or regurgitant flow, and perform a qualitative assessment of the tricuspid regurgitation severity. And use continuous wave Doppler across the tricuspid valve to assess the tricuspid regurgitation and measure the peak tricuspid regurgitation velocity. Now I'm going to show you one by one all the minimum dataset you need to obtain in order to perform an echocardiogram on the apical 4 and 5 chamber views, but this time on a video. Obtain an apical 4 chamber view and perform a visual assessment of the cardiac chambers, the wall motion, the valve anatomy, the interatrial septum, and the pericardium. Now zoom the left ventricle. Assess the wall motion of the inferior septum and the wall motion of the anterolateral wall, and look for any regional wall motion abnormalities of any of the segments. Next, assess the left ventricular volumes. First, measure the left ventricular end of diastolic volume in the apical 4-chamber view. Trace the endocardial border and index all the measurements by body surface area. Now measure the left ventricular end of systolic volume also in the apical 4-chamber view. Also trace the endocardium and index to body surface area. Now assess the left atrial size. Trace the inner aspect of the left atrial wall and exclude the left atrial appendage and the pulmonary veins. Measurements should also be indexed to body surface area. Now zoom on the mitral valve and assess the mitral valve anatomy and excursion of both leaflets. Now use color flow Doppler and look for abnormal, turbulent, or regurgitant flow. Visually assess the shape and size of the regurgitant jet. Place the cursor across the regurgitant jet and use continuous wave Doppler to assess the mitral valve regurgitation. A faint signal density is suggestive of mild regurgitation. And remember that the signal density increases as the mitral regurgitation becomes more severe. Also use continuous wave Doppler across the mitral valve to assess the mitral valve forward flow. Trace the mitral valve VTI to obtain the peak velocity, mean velocity, peak mitral valve gradient, and mean gradient. Once you finish these measurements, continue with the mitral valve inflow assessment. Place the sample volume at the tip of the leaflets in diastole and use pulse wave Doppler at end of expiration to measure E wave, A wave, deceleration time, and EA ratio. Now continue with the tissue Doppler imaging assessment. You need to do, if possible, an average of both septal and lateral wall measurements. So first measure the tissue Doppler of the septal wall and then measure the tissue Doppler of the lateral wall to obtain that average. Measure both to obtain the E' velocity, A' velocity, S' velocity, and the E' ratio. Next, you can perform a MAPSI assessment. MAPSI is the mitral annular plane systolic excursion, and you can obtain this by placing the cursor across the mitral valve annulus and pressing M mode. Let's continue and now perform a pulmonary veins assessment. Try to locate the pulmonary vein with color Doppler and use pulse wave Doppler to measure the pulmonary systolic and diastolic velocity, the pulmonary A reverse velocity, and the pulmonary SD ratio. Now obtain a zoomed view and assess the integrity of the interatrial septum. Use color flow Doppler over the septum to assess for any transseptal flow. Now let's continue with the apical 5-chamber view and perform a visual assessment of the LVOT, the valve anatomy, and sometimes you can see part of the ascending aorta. Now zoom on the LVOT and aortic valve. Use color flow Doppler to assess for any turbulent flow or regurgitant flow. Place the cursor across the aortic valve and use continuous wave Doppler to assess the aortic valve forward flow. Trace the VTI to obtain the peak and mean aortic valve velocities and the peak and mean aortic valve gradients. If there is trace of aortic regurgitation, perform an aortic regurgitation assessment. You can measure the aortic regurgitation pressure half time and also visually assess the jet density and contour. Now, place the sample volume at the LVOT and use pulse wave Doppler. This is to assess the LVOT flow. Trace the LVOT VTI to obtain the stroke volume, cardiac output, peak and mean velocities, and peak and mean gradients. Now obtain a right ventricular focused view and visually assess the cardiac chambers, the tricuspid valve, the free wall motion, and the pericardium. Start with the assessment of the right ventricular size. Measure the right ventricular basal diameter, the right ventricular middle diameter, and the right ventricular length at the end of diastole. Also, at the end of diastole, you can measure the right ventricular end of diastolic area. By measuring this area, you can also assess the right ventricular size. Now trace the right ventricular end of systolic area in order to measure the fractional area change. By measuring the fractional area change, you can assess the right ventricular systolic function. Now let's continue and assess the right atrial size. Trace the right atrial area and volume at the end of ventricular systole. The right atrial size should be measured at the right ventricular focus view prior to the tricuspid valve opening. Now zoom on the tricuspid valve to assess the valve anatomy and the leaflet's motion and excursion. Now place the cursor across the tricuspid valve annulus and press N mode to measure TAPSE. TAPSE is the tricuspid annular plane systolic excursion and is used to assess the right ventricular systolic function. Now use the tissue Doppler imaging at the tricuspid valve annulus. Use TDI and measure the systolic wave velocity to also assess the right ventricular systolic function. Now let's continue with the tricuspid valve color flow Doppler assessment. Use color Doppler and look for any abnormal, turbulent, or regurgitant flow. And perform a qualitative assessment of the tricuspid regurgitation. Now place the cursor across the tricuspid regurgitation jet and use continuous wave Doppler to measure the tricuspid regurgitation peak velocity. Remember also to assess the jet density and contour of signal. So, thank you for watching. Don't forget to like this video and to subscribe to my channel. So, see you in part 5 of this series of videos. Bye!